Welcome, students, and once again, I welcome Dr. Ravichand, who has secured AML rank 4 and CML rank 8. Congratulations, and it's actually a really good job because you also your first attempt, right?
Yes, sir.
Yeah, I was
Neurology.
Yeah.
Yes, sir. This is my first attempt with neurology, sir.
Yeah, so that is actually a really great job because to get into AIMS rank list, to top rank in the first attempt is really, really, really awesome. Congrats once again. Can you please introduce yourself? Where did you do your MD, MBBS, and who are there in your family? All those details.
Sir, I'm basically from Andhra Pradesh, sir. I did my MBBS from Usmania Medical College. After that, I did my MD from Institute of Medical Sciences, BHU, sir, which is in Varanasi. Yes, sir.
So, how are you feeling now?
Relieved, sir.
And did you expect this? Like, because you are first time you're writing AIMS, like to get into NEET is a bit easier than getting into INA, because INA for a first attempt you need to have a thorough knowledge of the basic subject, like the major subject. So that is actually not an easy job. It's
Yes,
actually really, really, really awesome job. And
yes.
did you expect this?
Sir, I was expecting something around in within 10 rank 10, sir, because even in grant test also I was getting rank 8 and rank 12, rank 7 like that, sir.
Yeah, so that actually correlate very much with our grandest, because the number of participants actually entering and writing the exam is very high. Almost everyone who might have been preparing might be there. So it's actually
Yes.
correlate very well, right? That's actually a new idea to me also, like almost near rank only. So
Yes.
first of all, what made you think of neurology? Why you chose neurology? And
Sir, actually, neurology is not my first option, sir. Frankly speaking, and this is not my first attempt with INI, sir. This is my first attempt with neurology, sir. During my MD
okay,
final year, sir, while I'm in MD final year, sir, I gave my cardiology, sir. I wanted to go to cardiology. So I got a rank 20, sir. I took cardiology names Rishikesh. After I worked for like 1 month or so, sir, I had to leave because of some health problems, sir. I have this some obstruction in my thoracic outlet, sir. Because of
oh,
that ledapron, it used to weigh
yeah.
heavy and sir, वो paresthesia और pain होता था, sir. So I had to leave it. Then, sir, within this, I couldn't give my NEET properly, sir, because I was there in Rishikesh. So I couldn't get a good rank in NEET, sir. Even though I couldn't get a good rank, sir, but with whatever rank I got, I took neurology, sir. Neurology, I also liked neurology during my MD days, sir. I took neurology, sir. It was a little bit with hesitation only, sir, not like completely going into neurology. I worked in an institute, sir, government institute for 3 months. After working for 3 months, then I realized कि this is good and I should do better in this. I liked it, sir, and I want to do in a good
Actually,
institute.
this is actually two extremes. Cardiology is totally a surgical branch, and coming back
Yes,
to neurology, which is totally a medical branch.
yes,
And actually speaking, I joined cardiology in the first NEET SS. I
yes,
joined Kottayam. I worked in cardiology for 2 months. Then, then I realized I want to go to clinical side, and at that time we had a last round counseling, the first NEET.
yes, sir.
So I then last and I joined neurology. So it is not a bad idea. Actually, it's a good idea because the background of cardiology is going to help you actually in neurology. Because I had
Yes,
gone the same path, but slightly different. Because when I joined cardiology, my idea of cardiology was more of clinical, but when I joined there, it is more of intervention.
yes.
And actually, this is because I feel like because you might have done well in your MD, because
Yes, sir.
MD, yeah.
My teachers during my MD residency were very good, sir. They taught us neurology very well, sir. Like everybody in my batch are interested in neurology, sir, one way or another.
Yeah, that happens because when you're done your MD properly, when MD the major subject, the chunk of the subject which comes in the practical will be neurology and cardiology. So
Yes,
definitely you will be exposed much more to cardiology and neurology.
yes, sir.
Even if you practice also, these are two subjects which the patients also keep on coming to you.
Yes,
So so you have a large story than I thought. Like you went to cardiology, then came back, then joined neurology, then come back and wrote the notes, then you cracked again. It's actually really, really inspirational story because those who are listening to this, who might have taken some course, are like out of the just first attempt, you don't know what is happening in these super specialties much. So you might have joined some specialities and come back and thinking to go back to totally different specialty and to to adjust with those specialty. All those things are there, but doing all those things, after doing all those things, you are cracking the entrance exam, that to AIMS, which is such a great rank, is really, really, really commendable job. So
I would say
congrats
it's
once
a
again.
bit risky also, sir.
Yeah.
I would say it's a little bit risky also, sir. Matlab doing all this.
Yeah, it is risky, but you have to take risks, man. And especially when it comes to your, like, this is, you're selecting your career. Like for us, it is like once you select it,
Yes,
many of the students doesn't know that idea, that once you select a subject, because even I didn't know that idea when I has
yes,
finished my MD. Once you select a subject for your super specialty, it's unlike medicine. This is going to your life. You will be spending more time, frankly speaking, you will be spending more time in your subject rather than with your family.
yes, sir.
So this is going to be your life. So if you
Yes,
take something which you don't like, that will be hell, because I have
yes,
experienced it.
yes, sir.
So how was the preparation, like during you were working in neurology at this time when you're preparing, right?
Uh, I was there for 3 months, sir. After that, 1 month before the exam, sir, 1 month or 40 days or so before the exam, sir, I left it. I thought, matlab, I need at least first time, sir, for cardiology. I prepared for 30 days. I got a rank 20, sir. So I thought,
You
matlab, I prepare for 10 more days and maybe I will get a better rank. So I took 40 days. I left 40 days before and I prepared, sir.
really, really nice confidence actually. Like now you did cardiology where?
AIMS Rishikesh, sir. That's for only for a few days, sir. Matlab, I left it very soon.
The neurology in
Sir, that is from IBAS, New Delhi, sir. Delhi,
which
sir.
one?
Institute of Human Behavior and Allied Sciences, Delhi.
Yeah, yeah, yeah. Delhi. Yeah.
Yes, sir.
So you might have exposed with neurology as well, and you started liking it as well. So how did you prepare during after the cardiology period? You went through. It is not an easy time for you. Mentally, it is not never an easy time for you. I can understand what all things might have gone to your mind, and then you came back. Still, you fight it hard, and you got a seat in neurology. Then also you were not satisfied, you want to get the best, and you are to prepare, you are ready to prepare. That is the most important thing. Like
Yes, sir.
once you get some branch, most of the people will not be ready to prepare once again. That is actually really, really I don't know how to tell it, really, really commendable job, because that needs lot of confidence and lot of self-respect. So that is really good job. And then you decided to move back to an exam. So how did you prepare after joining the neurology?
Sir, during those 3 months, sir, I actually didn't get any time to prepare, sir. But the point is, sir, I got exposed to the other side of neurology, sir. During MD days, we usually see the spine cases or MND cases or more so stroke cases, sir. But
Yeah.
once after I joined into DM, the other side, sir, we had a movement disorder clinic there, sir, dementia clinic, cognitive clinic. We had a cognitive clinic, epilepsy clinic, and stroke in reality, sir. Matlab, like those parts I got exposed, sir, and they were very interesting, sir. And this is what, sir, I just got exposed. Clinical exposure only was there, sir, during those 3 months. After that, during the 40 days, sir, which I took after leaving that 40 days, sir, I properly prepared, sir, that too through Marrow, sir.
And how
I
did you use Marrow? Like Marrow, you have medicine part, you have specialty part, you have high yield series, you have Q banks, test series. How did you use that?
During my MD days, sir, I watched some of your videos, sir. That is the approach videos, sir. Like you gave approach videos, sir. 1 to 2 videos before every system, sir. Like before attacks, everything. There are 1 to 2 approach videos. So I watched those during my MD days, sir. But now, sir, I watched completely, sir. Each and every module, every video you uploaded, I watched everything. Sir. It took like 15 to 20 days, sir, to watch all the videos
Yeah.
once. Sir.
Yeah, that is actually a great thing, because you were able to watch 15 20 videos in 15 days. Actually really good, because uh, actually the subject is too vast, and
Yes.
I could not cover actually all the videos, I mean all the topics in videos. So that I made some MCQs. That also is not covering actually, maybe covering, when you start reading neurology you'll understand, maybe covering 50%.
Yes, sir. That would be, sir. That would be one of my suggestions, sir. कि मतलब वो the MCQ videos, sir, whatever are there, the MCQ videos on CJD and the MCQ videos on paraneoplastic encephalitis and autoimmune encephalitis. Actually, they are asking questions from those areas, sir. Like 2 to 3 questions from each of these topics they are asking, sir. So, sir, मतलब like people, some, sir, even I thought I will leave those videos, sir, because they
That
are
is actually,
MCQ videos. People might leave those videos, sir, thinking that they are
yeah.
just the MCQ part of it, sir. if you can upload the original content, matlab like normal videos of it, sir, that would be like very much helpful, sir.
Actually, why I made the it into MCQ was because of a totally different reason. The what I thought was these are topics which a lot of questions comes, and
Yes,
questions comes from even minute areas. So I thought
yes,
like
sir.
if I deliver a lecture, you may
Yes,
miss those areas. This is more like volatile areas. So you need to know the values, you need to know the names. All those things are better conveyed through MCQ is what I thought. Actually, it is almost like initially I prepared as a subject only.
yes,
Then I thought I will break it and I will discuss a question, then discuss the area and go in that way. That is why I kept it there. So we will. I like to actually. I would actually. I need to update also because law time and encephalitis has changed. So
yes, sir.
we will update the new things with especially these areas. We will try to put separate videos also.
Even with
And
those videos, you answer most of the questions, sir. Matlab,
yeah,
even those videos covered most of the subjects, sir. We could answer most of the questions with those videos also.
yeah. Actually, everything is covered in that. But the problem is like what you tell when the student who is preparing watching those videos, they will think that this is unimportant. That is why I kept as MCQ. Actually, it is the other way. This is more important. So I
More
kept
that
it as
is more
MCQ.
important, sir.
That is why I kept it as MCQ because it will be more easy to remember things.
Yes, sir.
Yeah, that is actually a good point. Even I was thinking whether what to do with those areas because I wanted to create it as video, but to make it more palatable, I made it to MCQ. But the students who
Yes,
is watching it think that it is unimportant. That is why it is MCQ.
yes, sir.
And uh, how was the like you were able to finish like 15 to 25 days? You were able to watch the videos, and after watching that amount of stuff, did you felt that you were able to understand things better, or you were able to remember things better
Sir,
because it is a
actually,
large volume?
sir, most of the things which you explained, sir, most of those videos, sir, matlab, most of those cases I saw in my during those 3 months only, sir. Like most of the cases, sir, like even the dementia and movement disorder part also, sir, I was exposed during my 3 months residency, sir. So, matlab, it was a little bit easy to approach those videos, sir. Matlab, understand those videos and read them and remember them, sir.
And you have attended two times stage two preparation also. So stage two, what is your suggestions for stage two? And did you attended the stage two? We have done some like somewhat like a mock. It's actually not exactly mock because number of candidates are too much. So we did a mock like interview session. So how did you attend that, and how did you prepare for stage two?
So I couldn't attend to that, sir. Matlab, I don't know, sir. Somehow I don't didn't get the link or so, sir. Matlab, I couldn't attend to it. The mock interview session, if you conducted one, sir.
Yeah, how was your preparation for basically for part two? Because you have experience with the first
Yes,
aims. You have done one mock interview. You are more
yes,
experienced than anyone of us, or more than any of the faculty in Marrow because you directly attended one MCQ, like the second interview you had attended. So, how was your
yes,
experience? I can share it with others so that they can also plan for preparation because you have attended twice.
yes, sir. Sir, every department has their own way of conducting interviews, sir. Neurology has its own way of conducting interviews, sir. They usually spare, like, I think they put a timer or something. So they usually give 10 minutes for the interview, sir. For every candidate, they are interviewing for 10 minutes. They give two case scenarios, sir, and we have to answer it. Mostly the management and in how do you approach the case, how do you diagnose it, how do you manage it. Will be the most of the things, sir.
Yeah, and what I came to know from students is like you have attended cardiology also. Cardiology is more random questions, and neurology is a bit more organized question. That is what I came to know. I don't know.
Yes,
Personally, I
sir.
don't know.
Cardiology is very random, sir. Like cardiology is very random, sir. Like five people sit and they will ask whatever they want to ask, sir. Like randomly from anywhere.
Yeah, that is what I heard. Like neuro, when compared to other subject, neurology, the stage two, they have organized pattern. They have a certain questions, set questions. They keep on keeping that format for everyone, so that it will be almost uniform. That's actually a good thing from neurology part because otherwise it is very tough. Somebody coming and sitting and asking some random things means you don't have to prepare. Just go and face the interview and come back. And nothing else to do.
Yes, sir.
And during your MD time, how did you prepare? Like, did you use Marrow during MD time, and how did you help that?
Sir,
Because you
during my
after
MD time, sir, primary sources were Harrison and up to date, sir. During ward rounds, it used to be up to date, sir, and Harrison. Whenever we have to do any seminars or so, it's Harrison, sir. But from Marrow, sir, as I said, I watched those approach videos, sir. Matlab, the 1-2 approach videos which were in all the modules. sir, I watched your approach video, sir, because with that, we could know how to approach a clinical case, sir. And also our teaching schedules were also very good, sir. During the classes also our professors used to teach us very good, sir. So,
So during the MD time, what about other subjects like cardiology or general medicine videos? Did you watch those or?
sir, I couldn't say कि I watched everything, sir. I might have watched some of the general medicine videos from Rakesh Nair, sir. And it, yes, sir. Mostly from Rakesh Nair, sir's videos we watched during MD time, sir. मतलब, yes, sir.
Yeah, I want to tell everyone that you all have to read your standard books.
Yes, sir.
Whatever.
Harrison is.
Yeah,
I think that's the only time during MD, sir, we will get an opportunity to read
yeah.
Harrison, sir, and we should read at that time only, sir. After that, I don't think anyone will read it, sir. And reading Harrison is very much necessary to form basics.
Yeah, same thing. Like when I was doing my DM, you don't get much time to read textbooks. So
Yes.
you will be doing some presentations and all. At the end, when near the exam, I was sitting and reading my Bradley. Then one of many of the friends asked, "Why are you reading Bradley and wasting time? Because you cannot read Bradley page to page. You just prepare for some questions, read from some areas, some articles." Then I told that this is the only time I am going to read Bradley. Anyway, I had taken a degree. I had to read the textbook at least once. After that, I
Yes.
am not going to read it. So that is
Yes.
actually something which I have to tell everyone that once you join in a degree, read the books because you are not going to read it after passing out. Even if you whether you pass, whether you don't pass, that doesn't matter. You have
Yes.
to have subject knowledge. Read the book and read
Yes.
at least once or twice during your DM or MD time.
Yes.
Standard books you are not going to read once you start practicing.
Yes, sir. True, sir.
And what about your plan in the future? Now you are coming up from cardiology, you went back to neurology. So what are your plan? Because you have experience with movement disorder, your experience with dementia. So once you are exposed to neurology for 3 months, that is quite a good time, especially in an institute as a DM resident. So
Yes.
you might have focus to some areas. So did you find anything like that?
It's too early, sir. I have to study more, sir. As of now, I am not planning on any postdoctoral fellowship or so, sir. I have to do my DM residency properly, sir. First.
Yeah,
That is it.
but
That's the plan.
inclination will happen later once you
Yes,
join
sir.
because when like now the subject has changed a lot. Like it
Yes,
has
sir.
changed. It is actually neurology is one subject is changing very fast. Like maybe if you compare like 4 years or 5 years down the line, the PDF
Yes.
postdoctoral fellowships are not that common. But
Yes.
nowadays everyone is coming out with one PDF. So
Yes, sir.
I personally don't know how much it will help or not because uh, it's always general neurology is the king is that what I believe. And
Yes.
if you want for anything special, you have to practice neurology, then decide on that. That is what I believe. And so you how like what is your plan? You are planning for AIMS Delhi.
Sir, I mostly aims Delhi, sir, but I will inquire once, sir. I will do the inquiry once. How the departments are in AIMS, PJ, or Nimhan, sir. Mostly I will choose one among AIMS or PJ, sir.
AIMS or PT. Yeah. Both are good.
Yes, sir.
Both are really fun. You have to ask somebody who is doing residency right now because someone
Yes.
who has done the residency 3 or 4 years down the line,
Yes.
those faculties might not be there right now. It might
Yes,
have
sir.
changed a lot also. So you have to ask somebody who's doing right now and ask about the scenarios and everything and to decide. And really, actually, it is really nice to talk with you there because it is a really new thing for me also. Like I had first time interviewing somebody other than me who has done cardiology and came back to neurology. I
Yes.
also have gone the same path, but because of different reasons.
Yes, sir. Yes, sir. You told once, sir, somewhere in previous interviews also.
Yeah.
Mm.
That is a part you can do it. Like actually, for everyone who is watching, he's actually done a commendable job. Like this is most of the people never do it. Like once you get a seat, you'll be happy with that.
Yes.
Once you cannot continue the profession, you will get depressed. Like if you have went to cardiology and coming out, you will feel depressed. You won't feel like studying again. But he break that odds, everything, and he went and joined neurology. Still, he came back and he wanted to do it in the institute. So he came back and he wrote again and he joined neurology. That is actually really great. I'm really happy to hear that story. Really happy. Actually, I didn't knew all those things when before I'm doing the interview.
Yes, sir. Sir, I think I should thank my parents, sir, for spending a lot of money. I left 2 seats, sir, on me, and I will thank my friends, sir, Abha, Rashmi, Bhargav, Swati, Mahesh. These are my colleagues, sir, during my DM residency and MD residency. And I'd like to thank my junior Raviteja sir for providing me shelter during my preparation. And I would also like to thank IPL and my sister, sir, my stress busters during the preparation.
I feel also very, very nice to talk with you. Congrats again, and thank you for coming here and giving like you are actually a good example for anyone. I can suggest anyone to watch this interview specifically because this is something like totally inspirational. So
I also, sir, want to thank you very much, sir. I just watched your videos, sir, completely A to Z, and I watched it, sir. I think from last 40 days or so before the exam, your face is the only face which I saw for 10 hours a day.
thank you so much, and it's actually really make me more humble that somebody who is getting a great rank in a great institute thanks me. That is a great thing for me also. So, congrats and thank you for spending time and really nice to be with talk with you. Thank you.
Thank, thank you very much, sir. Thank you.